So then what happens after an aneurysm is diagnosed? Ultimately, the diagnosis just establishes that there is an abnormality of the blood vessel, and there are a number of factors that we'll want to better define to really understand the risks of this aneurysm for you, as well as what are some of the good ways that we can treat it, or maybe if it doesn't need treatment at all. You may have gotten this aneurysm diagnosed via something like a CT or an MRI. Those are different images of the brain that are used to take a look at the tissue and look at the blood vessel structure. A CT does involve radiation, and an MRI sometimes does not have as high resolution as some of the CTs. Ultimately, neither of these types of images tell us about flow over time, and so sometimes we may then further ask you to get a catheter angiogram. A catheter angiogram is a minimally invasive procedure with slightly higher risk than a CT or an MRI, but it can really give us the highest resolution definition of an aneurysm, as well as information about the flow of blood in and around the aneurysm. This is important information because it tells us about the risk of an aneurysm. Features of an aneurysm that increase the risk can be things like change over time of the size and shape of the aneurysm, the regularity of the dome of the aneurysm, the size of the aneurysm itself, as well as the ratio of the size of the aneurysm to the blood vessel that's connected to it. And there's also other things that are not even about images that you will need to talk to your neurosurgeon about to really define the risk. This includes things like risk factors with blood pressure control, not common in children, but sometimes in older teenagers, things like smoking, potentially even things like vaping. And finally, obviously, if there's a family history of brain aneurysms, and certainly if there's a history of bleeding in the family, then those are concerns that increase the risk. These are all factors that really need to be discussed cautiously with your surgeon before we can really think about what's most appropriate to manage your aneurysm.